our cover story, a new medication has been approved by the FDA that can reduce the risk of severe allergic reactions to food triggers in children and adults. It's the first of its kind, and ABC News medical correspondent Dr. Darien Sutton is joining us now with what we need to know. Dr. Darien, good morning to you. So first, tell us about this medication and how it could be used.
So the subject of this medication is anaphylaxis. We've talked about this before. In the emergency room, some of my scariest cases revolve around anaphylaxis. And this new medication called Xolair has been FDA approved to help prevent that. So the way that it works, it's an injectable medication given in the very similar way that an EpiPen is. And it's been shown in studies that when patients are given them every few weeks, depending on their age and their weight, it substantially reduces their risk of anaphylaxis. And we're talking about allergies to peanuts, milk, egg, and other common nuts. You can imagine what that means for the person who lives with that threat, who has to get on a plane and has to fear that. This is a medication that can reduce that substantially.
And help explain the difference between just an allergic reaction and the more severe anaphylaxis.
That's a good question. So an allergic reaction typically involves one organ system, for example, skin or a rash or hives, whereas anaphylaxis typically involves more than two organ systems. So that is a rash as well as throat swelling, or digestive symptoms like nausea and vomiting, or a high heart rate, or a drop in blood pressure that leads to fainting. So that's how you define the difference between allergic reaction and anaphylaxis.
What about an emergency? And if it's not this medication, what should people do?
So this medication, although it's given in a similar way to an EpiPen, it's not meant to be used in an acute emergency. That's what an EpiPen is for. So if you think that someone is suffering from anaphylaxis or having difficulty breathing after eating something, first off, call 911. If there's an EpiPen available, use it. Just remember to take a moment and read the instructions, make sure that their clothing is loose, and continue to monitor them. And the way that I monitor patients that I'm concerned about with is I talk to them. Is the patient having difficulty speaking? Is their voice changing? Are they taking breaks between sentences? That helps me to understand, because even if it gets better, it might recur, which is why even if it gets better outside the hospital, you still should bring them into the ER.
And this seems like such a game changer, too. We were talking before we came on here, people who live with these allergies, live in sort of constant state of fear because you can't control everything. You go out to restaurants, you never know what might be in the food.
It's true, and it's estimated that up to 5% of people live with that threat. That equates to more than 16 million people. So you can only imagine what this means for those who have that fear, and also parents who send their kids off to school who might have that fear. And so this can substantially reduce that risk. And I think it's phenomenal that we have opportunities like this in science.
Dr. Darien, always appreciate you coming in. Thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.